Hi, good morning, everyone. My name is Fatima, and today I will be discussing hypertension in relation to Mr. Devon Jones' case, which is our patient. Let's define hypertension. Hypertension is an increase in blood pressure. This is hypertension is a good example how our body system interacts with each other. As we all know, hypertension is mainly affects heart. However, there is a complex interaction between the cardiovascular and the renal system. Why? Because of the production of renin, which we will be discussed later on in the pathophysiology. But first, let's discuss first the variables or the determinants of the hypertension. So the blood pressure balance, consists of balance between the cardiac output plus and peripheral resistance. The cardiac output is the number of heart heartbeat in a minute times the stroke volume, which is the amount of the a injection of from ventricular in a heartbeat. So in that, you're gonna have a sum total of cardiac output. While the peripheral resistance, it consists of small arteries. These are the smooth muscles that are made for contractility. So a normal blood pressure, you will see a balance on it. So we have two causes of hypertension. One is the primary, which is 95% of the populations uh, attribute to this one, while the secondary is the remaining 5%. The 95% is like a lifestyle factor. We could see the lifestyle factor such as increased salt consumption, alcohol, smoking, stress, and also genes, hereditary, if a mother, the offspring, and then the other 5% secondary, they are known to be like less than 18 to 40 years old. Normally, it happens within that age. And then it also manifested after medical condition. It's like a complication or secondary to the medical conditions that they're experiencing. And then it's also can be in a form of medication, use of medications such as the birth control, um, hormonal therapy, uh, the decongestant, uh, what else? Illegal drugs. Those are the illegal drugs, and the antihistamine. So they are also contributing factors for the secondary 5% of hypertension. And then it becomes complicated hypertension when the patient going through an increased BP with associated end organ damages. As we all know, the longer the uncontrolled hypertensive is, the um, the greater the damages, which is irreversible. So one complication that we could attest to this is the anterior sclerosis, wherein there is buildup of plaque over time. Because if you find like a resistance to the blood pressure over time, it will create a plaque, uh, which will later on become hardened for the blood to circulate, and it will produce a lot of complications like heart failure, aneurysm, strokes, and kidney failure. So those are the complications of hypertension that we do not want. So we are going through. So our body, even if we're gonna go to the pathophysiology, our body will um, try its best. Will try its best to maintain the homeostasis. Any dysfunction or disturbances will create um, a condition or a disease, a condition or with pathophysiology of hypertension. There is like the renin angiotensin aldosterone system, which is the RAST, is a hormonal system which control the blood pressure. The renin is being produced in the kidney. That's why, as I mentioned earlier from the introduction, that it really plays a big uh, a big role in hypertension, wherein the kidney releases renin in the bloodstream, making it as a plasma uh, protein, converting to angiotensin by the liver. Later on, it will be converted into angiotensin 2 predominantly by the lungs and the kidney, where it binds angiotensin converting enzymes ACE and angiotensin 2 to stimulate uh, constriction to retain water because there's a presence of salt. There's a presence of because water goes where salt is and like versa. So the more volume in the body, the more it increases the blood pressure. Uh, it will challenge the body to uh, pump more blood uh, or or circulate more volume in the body. So we're retaining, so you will notice some edema, um, which could cause so later on uh, causes peripheral or peripheral circulatory problem. And then also there is a if there is a prolonged contraction, like what is happening, like prolonged smooth contractility, um, the construction of our body will be impaired or dysfunction, making the blood vessels thicken and harden. So it will be hard for the blood to pass through a narrowed vessels, making an increased uh, pressure in there. So over time, it will create a vascular changes such as that will gonna remodel the lumen. Uh, Also, one of the causes here is the insulin resistance. I also read about insulin resistance can be uh, helpful and detrimental. It also protects us because it also has an inflammatory response. But however, it also can cause problem later on because it retains it retains sodium, and also it has a pro-inflammatory reaction causing inflammation to our body. So it also increases the systemic vascular resistance, and all of this being said will contribute to hypertension. All information that was shared by Mr. Jones um, with the family history are pertinent. He mentioned about the age, 40 years old, the race, African American, the family history where both mother and father were diagnosed of hypertension, were a risk factor for him to acquire or have hypertension. Unfortunately, he was already diagnosed 5 years ago with hypertension. That's why he ceased smoking. That is a good way to start. Uh, However, because of the lifestyle that he is currently practicing right now, makes the condition unmanageable. So the goal right now is for us to be able to manage uh, his um, his hypertension, or putting the blood pressure within defined limits by modifying the lifestyle. Uh, he mentioned about drinking alcohol, um, about not really paying attention on the salt content or the food that he's taking, physical inactivity, and gaining extra 20 pounds to his current weight. So, based on the book that we read, the Pluga and Strong of 2019, it mentioned that drinking alcohol might just have a temporary effect, um, but it affects the SNS and ROS dysfunction later on, which will cause vascular changes or uh, the structure of the cell later on will cause hypertension. Same thing with smoking, is the same reason causes a temporary uh, loss or temporary effect, but frequent practice will bring a detrimental effect. So with the salt content, our body is already retaining salt, those who are hypertensive. So it's better that we modify or we regulate the salt intake that we take. For normal people who weren't diagnosed with hypertension, it is recommended 2,300 milligrams salt. It's less than teaspoon a day, but it would be better if it's within 1,500 milligram for those who are diagnosed. You will see some significant uh, significant findings of lowering down the blood pressure within the normal limit. And aside from that, gaining weight of 20 pounds is no good too. So it is um it's the goal as well is to maintain a healthy weight, because the less volume that our body contain, the less the our but the less volume will be less pressure, as evidently the heart will pump less fluids, and we're not gonna retain any more extra fluids that our body would not get then. So that's it for now, and I hope uh, I made some clear with regards to my discussion. Thank you.